The sudden, suffocating heat of a hot flush, the exhaustion of unpredictable mood swings. For millions of women, navigating the daily realities of perimenopause and severe menstrual symptoms is a relentless, exhausting cycle. To find relief, a growing community of women are bypassing traditional remedies and turning to something entirely different, plunging themselves into freezing open water. The evidence for this practice comes straight from the lab. In 2024, researchers from University College London published a comprehensive study tracking over 1,100 women to measure exactly what cold water immersion does to the female body. The data revealed that nearly 47% of participants reported significant reductions in anxiety. In fact, over 60% of the perimenopausal women surveyed swim specifically to manage their reproductive health symptoms. To understand why this works, we need to decode the biology behind the chill. We will look at how freezing water alters your brain chemistry, pinpoint the duration needed for results, and outline a safe routine you can start tomorrow. The psychological data from the study was remarkably consistent. Exactly 46.9% of menopausal women and 46.7% of menstruating women recorded a drop in their daily anxiety levels. This diagram shows the HPA axis, your brain's central stress response system. Stepping into freezing water triggers a sharp spike in stress signals and adrenaline, but repeated exposure trains this system. By forcing the HPA axis to react and recover, baseline cortisol levels drop, lowering overall stress. The psychological relief these women experience is the result of a physical adaptation in how the body processes and recovers from chemical stress. Beyond the mind, the cold water exerts a powerful physical force. The study recorded a 30% reduction in hot flushes, alongside significant improvements in joint and muscle pain. A hot flush occurs when your blood vessels rapidly dilate, flooding your skin with heat. Freezing water counteracts this through vasoconstriction, forcing your blood vessels to shrink and rapidly cooling the body down. The study also quantified the exact amount of time and frequency it takes to trigger these specific physiological changes. Looking at this chart, symptoms require different schedules. Swimming once a week dropped anxiety by 35%, while daily summer swims maximized hot flush reduction. As duration shifts, winter swims between 15 and 30 minutes proved most effective for lowering hot flushes, outperforming quick dips. One of the more surprising findings was that wearing a wetsuit in winter correlated with better sleep quality than a standard swimsuit. This is likely because the wetsuit acts as a thermal buffer, preventing the extreme core temperature afterdrop that can overstimulate the nervous system and disrupt rest. The data also pointed to a non-biological factor. Free text responses in the survey repeatedly highlighted the community itself. These swim groups create a safe, body-positive space for women to openly discuss symptoms that are often treated as taboo. Effectively managing symptoms requires a specific routine of duration and frequency, paired with the social support of a shared community. We have to look at these numbers with a clear head. The UCL study relies on self-selection bias, meaning the participants surveyed were already active swimmers who believed in the practice. And the water itself comes with severe physical dangers. Plunging into icy water triggers an immediate involuntary gasp reflex known as cold shock, which can lead to drowning or rapid hypothermia. This sudden stress can also cause autonomic conflict. This occurs when the body's nervous system sends mixed signals to the heart, potentially triggering dangerous cardiac rhythm disturbances in vulnerable individuals. And the environment presents its own hidden hazards. Swimmers must rigorously check local waters for raw sewage pollution, which carries a high risk of causing severe gastroenteritis and other infections. Because cold water immersion is powerful enough to lower cortisol and force blood vessels to constrict, it is also powerful enough to be deadly if approached without preparation. If you are ready to test the water, start with caution. Acclimatize to the cold very slowly to avoid that initial shock reflex, and always verify the quality of your local water source before getting in. Build toward a 15 to 30 minute duration if you can do so safely. Choose your frequency based on your primary symptoms: weekly dips to manage anxiety, or daily swims if you want to tackle hot flushes. Most importantly, do not do this alone. Seek out a local cold water swimming group. They provide critical safety supervision and the psychological companionship that makes this practice so effective. Navigating reproductive health can often feel like losing control.
Stepping into the freezing water is a way for women to reclaim power over their own bodies, managing their symptoms on their own terms.